Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss epilepsy in pregnancy, anti-epileptic medication in pregnancy, the stages of labor, delivery by C-section, antenatal complications, and postpartum. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link at the top of our channel and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. Going through pregnancy and carrying a healthy baby to term is overwhelming for any woman, but is even more so for women with epilepsy. With proper knowledge and a team of healthcare providers, women with epilepsy can have a safe and healthy pregnancy. On average, 24,000 infants are born to women with epilepsy annually, with a standard birth rate of 3 to 5 babies per 1,000 childbirths. Due to medication and other treatments, it is highly recommended that any plans for conceiving be discussed with your obstetrician, neurologist, and anyone on your support team. Planned pregnancies are encouraged to adjust medication doses and reduce the risk of any fetal abnormalities and to control the frequency of seizures. Having a seizure during pregnancy can result in a decrease in fetal heart rate, decrease oxygen, cause low birth weight, and preterm birth. Additional risks are teratogenic effect, congenital abnormalities, and dysmorphia. The risk of babies of epileptic mothers not on AEDs developing congenital abnormalities range from 1.1 to 1.3%. Risk of abnormalities increased to 4 to 9% on AEDs, especially on valproic acid and polytherapy. Studies have shown taking prenatal vitamins along with 5 milligrams of folic acid daily can prevent fetal deformity and help to reduce seizure activity. Any amount over 5 milligrams is not recommended. In the first stage of labor, known as early labor, starts with the dilation of the cervix and ends once the mouth of the uterus reaches 10 centimeters, full dilation. The first stage of labor can last on average 6 to 12 hours. Contractions can occur every 5 to 15 minutes and last on average 60 to 90 seconds. Labor consists of contractions of the uterus and a combination of the pressure of the baby's head against the cervix, causing dilation. The pituitary gland releases oxytocin into the bloodstream. While uterine contractions take place, the production of prostaglandins increases, increasing the frequency of the contractions. Labor can also be induced by manually opening the cervix, breaking of the waters, or through medication. Active labor starts when the cervix has dilated to 6 centimeters. Contractions become stronger, longer, and increase in pain. Average time of contractions is 3 minutes apart, lasting 45 seconds. For mothers who have decided to have pain medication, such as an epidural, this is the time for them to request help to alleviate pain. Moving around, drinking fluids, using the bathroom, and keeping active helps the mother to get the cervix to dilate and help labor progress. The third part of stage 1 labor is known as transition. Transition for many mothers is the toughest and most painful part of labor. The cervix is dilated at 8 centimeters when transition starts and dilates to 10 centimeters to start the second stage of labor. Transition can last on average 15 minutes to 1 hour. Contractions are close and last on average 60 to 90 seconds. The mother may feel a lot of pressure in the lower back and rectum. In the second stage of labor, the cervix is fully dilated, allowing the mother to push the fetus down the birth canal and out. The second stage of labor can last on average from 30 minutes to a few hours. The second stage of labor can last longer for first-time mothers or if you have had an epidural. Contractions can slow down, coming every 2 to 5 minutes and lasting 60 to 90 seconds. Some mothers may need an episiotomy to help guide the baby out. Most mothers do not need an episiotomy. The obstetrician helps to guide the fetus out of the birth canal. In some situations, use of forceps or suction may be needed. When the fetus is delivered, it is now an infant. The umbilical cord is cut unless the mother states in her birth plan that she wants to delay clamping to allow the blood from the placenta to transfer to the infant. In the third stage of labor, the maternal placenta is delivered. The placenta detaches from the uterine wall and passes through the birth canal. The mother pushes the placenta out. The third stage of labor is the shortest and usually takes no more than 20 minutes. Contractions to help the placenta descend are closer but not as painful. The third stage of labor starts around 5 to 30 minutes after the second stage of labor ends. If cord clamping was delayed, this is where the umbilical cord is clamped and cut, separating the fetus from the placenta. Stage 3 is the last stage of natural childbirth. The mother may experience chills or shakes after birth due to the increase in hormones. If too uncomfortable, the obstetrician may administer medication to reduce any discomfort. The last stage is known as the recovery stage. At this point, rest for the mother and infant should be prioritized. Skin-to-skin contact and breastfeeding is encouraged at this point. On average, 1 to 2% of women with epilepsy experience seizures during childbirth. Labor can cause stress and induce seizures. There is no evidence that shows the use of AEDs harms the process of birth or immediate postpartum. Risk of seizure activity during childbirth may decrease if AED levels are maintained during the last trimester of pregnancy. The use of AEDs should not be stopped during pregnancy as it could have adverse effects on both the mother and fetus. A cesarean birth, also known as a C-section, is done if there are complications with a woman's pregnancy or it is the safest way to deliver the baby. There is a higher risk of having a C-section than a natural birth. The doctor makes an incision into the belly and uterus to help deliver the fetus and placenta. Emergency C-sections are done when the mother's or baby's health is in danger. Most C-sections are scheduled. C-sections may be scheduled due to placenta complications, infections, pre-existing conditions that can cause complications, multiple birth, labor does not progress, breech position, baby is too large to go through birth canal, umbilical cord complications, fetus is in distress, or certain birth defects. Women with epilepsy have an increased risk of developing mild preeclampsia, gestational hypertension, bleeding during pregnancy, and excessive bleeding postpartum during or immediately after pregnancy. Though it is unclear if the increased risk of pregnancy-related complications stems from the condition itself, the use of anti-epileptic drugs, or both, current research points to the use of medications and the dosage during gestation. For women with epilepsy, the postpartum period can be a vulnerable time due to any medication changes, stress, sleep deprivation, and any challenges with breastfeeding. The adjustment of AEDs during postpartum can create difficulty in controlling the frequency of seizures and increase the risk of developing postpartum mood disorders. It is essential that mothers with epilepsy have a strong support system to facilitate proper healing and bonding with their new baby. Eating balanced meals, adequate sleep, and receiving proper physical, emotional, and mental care is essential for a mother with epilepsy going through the postpartum phase. Caring for women during immediate postpartum promotes the overall health and well-being of new mothers, may increase the recovery rate. In conclusion, going through pregnancy and carrying a healthy baby to term is overwhelming for any woman, but is even more so for women with epilepsy. With the proper knowledge and a team of healthcare providers, women with epilepsy can have a safe and healthy pregnancy. Planned pregnancies are encouraged to adjust medication doses and reduce the risk of any fetal abnormalities and to control the frequency of seizures. There are 4 stages of labor. The first 3 take part during the natural childbirth. The 4th stage focuses on recovery. Women with epilepsy have an increased risk of developing mild preeclampsia, gestational hypertension, bleeding during pregnancy, and excessive bleeding postpartum, during, or immediately after pregnancy. For women with epilepsy, the postpartum period can be a vulnerable time due to any medication changes, stress, sleep deprivation, and any challenges with breastfeeding. It is essential that mothers with epilepsy have a strong support system to facilitate proper healing and bonding with their new baby. To learn more about epilepsy and childbirth, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.